After trauma or serious illness, a patient's vital signs need careful monitoring in the ICU. Now more than ever, all that data coming in through the varying machines are put into records, given to doctors in varying ways, and are used much more effectively. You'll see what I mean in our report about the intensive care of today at MEDICA 2017.
The situation for us is that we have a big change in the hospital market. So we have more and more people from different countries. What we need is intelligent ventilation, help with monitoring, with everything, to take over part of needs from the nurses, from the physicians, help them to make the life easier, saving time.
And within intensive care today, we need to have more and more automation to assist caregivers to provide the best clinical care to a patient, either in ICU or in theatre. So in IMT Medical, our Bella Vista, our ICU ventilator, we are looking at more and more automation as a tool to take over some key parts of the ventilation strategy that allow the people to use the ventilator much easier, and also to shorten training times for caregivers.
We are try to complement and find complete solutions with a high level of technology to integrate all the equipment in the service and the unities in the hospitals.
The challenge now is the space, the integration of the information, and the costs. So we want to save costs, save space, and to have the most integration of the equipments.
Today we have our root remote platform monitoring, and which is actually also a connectivity solution. And thanks to this platform, we can connect different devices so that they can share information and then send it to the EMR.
One of the main challenges clearly is EEG. The European Society of Intensive Care Medicine recommends to do continuous EEG for every patient who is in unconscious state. But even trained physicians or technicians, they need for 30 to 40 minutes to apply the EEG. They will not have the time to do so. So we are happy to present our newest innovation and technologies. This will help anyone to apply EEG within 5 minutes.
So Space Lab Zscaler is able to provide all the vital signs, all alarm information, trending, plus all the other surrounding information. And by integrating all this data and interfacing them with hospital information systems.
So as you can see, just as with yesterday, today's systems absolutely depend on accuracy of the data they're providing. But the networking of that data is going to play an ever greater role into the future ahead.